Hello, Penn Medicine colleagues and friends. I'm Dr. Carmen Guerra. I'm excited to speak with Dr. Deborah Driscoll and Dr. Elizabeth Howell about the Obstetrics and Gynecology Department and their vision for the department moving forward. Dr. Driscoll and Dr. Howell, thank you both for joining me today and welcome.
Thank you, Dr. Guerra. I've been at Penn for over 35 years. I came here for a residency in obstetrics and gynecology, and then I completed a fellowship in both clinical and molecular genetics at the University of Pennsylvania. I started my career here at Penn as a physician investigator in a lab at Children's Hospital of Philadelphia, studying DiGeorge syndrome, and identified a deletion on chromosome 22 that causes not only DiGeorge syndrome, but a number of other disorders, such as velocardiofacial syndrome. I was formerly a clerkship director and vice chair for academic affairs before assuming a position as chair of the Department of Obstetrics and Gynecology. So it's been a great career.
So just to sort of share a little bit about myself with you, I grew up in Seattle, Washington. I went to Stanford for undergrad and then spent a year teaching in Kenya. And I taught in very rural northwest Kenya, teaching biology and chemistry. I came back to the U.S. I pursued an MD and a Master's of Public Policy degree, and then did my clinical training in OBGYN. And prior to coming here in September, I was actually at Mount Sinai, the Icahn School of Medicine at Mount Sinai for the last 20 years. As you have heard, I've done a lot of work on quality of care and racial and ethnic disparities in maternal and child health. And many times people ask me, where did that interest come from? And, how did you get here? And one of the things I often think back to are is my year in Kenya and how it impacted my career choices. And, the opportunity to learn about a different culture and a beautiful country was, amazing. But I also saw, firsthand the role of women sort of on a global scene and saw how they were the backbone of the family and that they, worked incredibly hard, doing all sorts of chores as well as farming, and how families were devastated by illness because of lack of access to healthcare and then lack of education for women. And so I came back to this country with a strong interest in sort of serving women, and thought initially that I would probably do more on the global health side. And then I came back here and realized that many of the same things that were happening there were happening here, and decided to sort of focus on disparities here in the United States. And, in addition to that Kenya backdrop, just growing up in a family that was really focused on social justice, and my father was a civil rights attorney. So again, all of these things that sort of influence your career choices and how you think about the world, really from my childhood all the way through my college and my education. What brought me to Penn, especially in this moment in time, with this unbelievable pandemic going on and sort of the changes that our country has been going through. And I'll have to just say that it's really because, on the national scene, this department of OBGYN is known as one of the best in the country.
Your story about Kenya really rings true to my heart as an immigrant born in Honduras who came to the U.S. at the age of 3. I got to go back and see the state of the people there, the women in particular, and that created in me at a very young age this sense of wanting to achieve equity, that opportunities shouldn't matter because of where you were born or the color of your skin or your gender. So we're thrilled you're here and have joined the Penn Medicine family. Dr. Driscoll, I understand you played a unique role in identifying Dr. Howell. Can you share with us how you came to know Dr. Howell and what led you to recommend her to the position of chair of OBGYN?
So about a week after I announced that I was stepping down as chair of the OBGYN department to accept this new role in CPUP, I was at a national meeting in Chicago. And Dr. Howell was one of the presenters, and she was talking about the work that she was doing in New York State and New York City to reduce health disparities and improve maternal and infant outcomes. And as I listened to her, I was, of course, very impressed. And the more I listened, the more I wondered, would she be a good candidate to be chair of the department? And so I whipped out my phone. I quickly Googled her. I started reading about the work that she was doing, and also the work that she did on faculty development and mentoring. I sent her name to the chair of the search committee and said, this may be someone you want to consider for the chair. So that was my small part. And I was just delighted when I learned that she had been selected by our dean and CEO to be the next chair of obstetrics.
I had heard that the University of Pennsylvania chair position had opened up. And I had, never thought, I wasn't thinking at that time of applying for it, but I thought to myself, boy, whoever lands that job is going to be certainly pretty lucky. The other reason that I came here was the incredible leadership here. I think there's this, very strong collaborative culture around teamwork. And I was really particularly struck by Kevin Mahoney and his leadership style, his integrity, and his commitment to community. And I felt that, he was going to be a partner in this effort to try to really address health equity. And that was the other reason that I was incredibly excited to come.
Dr. Howell, given that you're an accomplished researcher in health inequities, can you touch on the important work that you're doing around this and your plans to reduce maternal mortality in Philadelphia and beyond?
Yes. And so, one of my goals and what's sort of my mission is sort of to provide high quality care to all women. And I'm so pleased that to be at Penn, because I believe this is a shared goal, not only by Dr. Driscoll and the CEO, but all the department members of OBGYN as well as many others. And so it's a really exciting time to be here and to have this be part of our shared vision. And what makes me really excited is that I think, Penn has already started to build a toolbox in this area. And so it's the perfect place for me at this moment in time to continue this work, build with my colleagues here, and then extend it hopefully in years to come to even more broadly in Philadelphia and beyond. And as I've have already had a number of conversations with people, not only here at Penn, but at the DOH in Philadelphia, trying to start thinking about linkages to the right community organizations so that we can continue to build this work out. The other thing I'm incredibly excited about is, literally on my second day here, the third day here, I got a call from the CEO saying, we have these Penn Medicine team leadership goals, and we want equity to be part of this, and we want to do something around women in equity and around reducing maternal morbidity and mortality in Black women. So it's a very exciting time, and I think it's an amazing commitment by Penn Medicine. And I think it's probably one of few healthcare systems in the country that are tackling these health equity issues head on.
As an obstetrician gynecologist, it's alarming to me as a woman that in this country, this well-developed country that just spends so much money on healthcare, that we have some of the highest rates of maternal morbidity and mortality in the world. And they're rising. And with all the sophisticated technology and medical care that we have available, we should have the lowest rates. And so this is one of the most important issues that we need to address. It's the most important public health issue, in my opinion, in this country. And Dr. Howell commented on the disparities that we see, and it's true. 1 out of every 10 babies in this country is born before 37 weeks. But if you look in this city of Philadelphia, there are neighborhoods where, it's much higher. It's almost double, one in 5. And so we have a lot of work to do to understand the causes of preterm birth and then to try to develop more effective strategies to prevent and treat preterm birth. We received a grant from the March of Dimes to be one of 5 March of Dimes prematurity research centers and numerous other research programs, all funded by NIH. And many of those programs have really established new guidelines or standards of care. And our goal was to continue to advance care that would lead to improvements in both maternal and infant care, very consistent with what Dr. Howell's interest is. And what Dr. Howell now brings to the department is her background in health policy and health services research, which I think is a wonderful opportunity for us to collaborate with the Leonard Davis Institute and to really take this department in new directions.
And I'll add that as a general internist, when I see patients, they have disparities that are cumulative throughout their lives. And those cumulative disparities end up causing disease and illness and reducing quality of life. If we're going to solve disparities and reduce and eliminate them, we have to start where it all starts. And that's why I consider the Department of OBGYN's work so critical, because it starts with a healthy mother and a healthy birth, and then it proceeds from there. And so I value greatly what my colleagues in the Department of OBGYN are doing to eliminate disparities. Next, I'd like to ask, what are some of the steps that you and your team are exploring to try and make meaningful change and execute your mission?
In the maternal fetal medicine division, there's a long history of doing some work in this area. And specifically, there's a program that we're very proud of in this department called the Heart Safe Motherhood Program. This was developed by Dr. Adi Hirschberg and Dr. Sindhu Srinivas. And the idea behind it is really just to have a text-based surveillance program for home blood pressure monitoring. And just to remind everyone that the first few weeks after delivery for pregnant women who had hypertension during their pregnancy is a risky time period. And our national professional organization, ACOG, really recommends that we have more intensive monitoring during this period. And that's been a challenge because patients are at home. And we want to capture them at home and manage their blood pressure before they actually turn up back in an emergency situation with a very elevated blood pressure that can put them at risk.
Dr. Driscoll, under your leadership, the Department of OBGYN became one of the most highly regarded OBGYN departments in the country for research, clinical programs, teaching, and innovation. You're also the first woman who has been chair of OBGYN at Penn and an inspiration to women in many fields. Can you share what you're most proud of during your time as department chair and what your hopes are for the department as Dr. Howell takes the reins?
The first major priority for me when I started as a chair was to expand the clinical footprint and to develop novel services that women in our community needed. We also partnered with hospitals that were becoming part of Penn Medicine. So when Chester County joined Penn Medicine, they approached me and said, we want to develop a GYN oncology program here. So we recruited Dr. Gentoli from Johns Hopkins, and that program has just grown and expanded, and they added a second physician just recently. Princeton Medical Center approached us about setting up a maternal fetal medicine services 5 days a week there, and Bob Dept set that up, and that has been a wonderful collaboration with Princeton. And most recently, we partnered with Lancaster General Hospital to help them set up a fertility program. So we have established many collaborations and partnerships over those 14 years to serve the needs of each of the communities. And so most of those programs that I mentioned have very robust research programs. And it was important that we would develop a research infrastructure to support our faculty and our trainees. And so over those 14 years, we doubled our research budget, but we made significant investments in developing the Women's Health Clinical Research Center led by Kurt Barnhart, the Penn Ovarian Cancer Research Center, now led by Dr. Ronnie Drapkin.
And we thank you for your many years of dedication, for being a trailblazer, and for really building this department to what it is today. As a final question, in addition to the things you've touched upon as to why this department is so successful and the things that excite you about working at Penn, I'd like to wrap up our discussion by understanding why Penn. Dr. Driscoll, you've been at Penn since your residency, and Dr. Howell, you're just getting started here after 20 years at another institution. Can you both share your perspective on why Penn is the place you'd like to continue your careers?
I'll start by saying I am going to finish my career here at Penn. I've always valued the fact that we have every graduate and the undergraduate school right here on the same campus, and that just fosters that collaborative spirit. And it's just a truly amazing place to work. I know it sounds cliche to say that, but it's like a family here, and I can't imagine ever working anywhere else but at Penn Medicine.
You know, I've shared a little bit already about how exciting it is for me to sort of try to build on this incredible department and to try to hope to continue this upward trajectory and to think about the next stages for this department. That's a really exciting opportunity. And so I think it's the combination of the opportunity, it's the people, it's the leadership, and it's the many, many people during this incredibly difficult time of this pandemic who come to work every day and give their best. And so, you know, it's all of those things that make Penn such a special place. And I'm very excited to hopefully spend the rest of my career here as well.
Thank you both. In closing, I'd like to thank Dr. Driscoll and Dr. Howell for their time and for their dedication to improving the health of women and children. Their leadership supports Penn's efforts to study and implement new approaches in providing high quality and equitable healthcare for everyone. Thank you for watching, and please continue to join us for future features highlighting the incredible work being done at Penn Medicine. Thank you.